Food for Thought with Professor David Ndete.
Welcome to another episode of Food for Thought with Professor Ndete as we delve into the discussion on eating disorders. Does it have treatment? Is it treatable?
Yes. Before we get into that, and since there are so many ideas floating, and I tend to get carried away, just make sure that you keep on bringing me back to
yes.
About two-thirds, about 66%, they also have very severe depression.
I can imagine. I can imagine, yes.
So you need to treat that depression. About a third of them, we know these are just averages. They have social phobia. In other words, they just want to be left on their own because they don't want other people to notice that their eating habits, because they don't want to eat other people's, so they tend to be left. They want to be left alone. So, and a few of them may have maybe 20%. Something you call obsessive compulsive disorder is a ritualistic way of doing things, and particularly ritualistic way of eating. Yes. Does it have treatment? Yes, it has treatment.
Okay.
And the first treatment is you save life. Okay. If they have reached a stage where they are developing these complications, the body temperature is low, the heart rate is low, then they develop low blood pressure, and then there are changes in the blood chemistry, and here we are talking about excessive loss or low levels of this something called potassium. Then you know you are on your way to death. You are on your way to maybe heart attack. Please, it's an emergency. You treat them. And you treat them by feeding them. Okay, you can feed through that tube. You can feed through the blood. You can also give some medicine that will allow them to calm down a little bit and maybe stimulate a little bit of appetite. Yes. So you feed them, and you feed them up to a certain level of nutrition. They have no choice as to whether they have the liberty of going to eat alone. The eating must be supervised.
Yes.
You make sure that
because left alone, they will not eat.
They will not eat. They must be supervised. You make sure that they don't have access to pangatis, those things for cleaning the system. And another thing that you may need to watch is that some of them may want to do a lot of exercise, and then we say it's normal because doing exercise or jogging is a normal. We may jog because we think it's healthy, but for them they are jogging or doing exercise because they want to lose weight, and realistically. So you look for those loopholes and you close them. So they must feed. You must reinstate the body to its normal functioning in terms of nutritional status. The potassium levels are normal. The heart rate is within a certain given range, within the normal. The blood pressure is back to within certain normal. And if they develop other complications, sometimes they get problem with the thyroid. You make sure that the thyroid is done. So now that when they come, you do a complete profile of investigations. Chemical, thyroid, and and very many other things which you can think of, because there might be a problem in the pituitary. We can talk about that somewhere in the brain. So you do that. Bring them to normal level of nutrition. Treat the depression. Treat whatever the psychiatric condition that might be there. And then, once you have done all of those, you are taken care of all of those, sit down and understand the psychodynamics in the head of this girl. Is it because of fear of becoming a woman, or is it because of relationship within the family?
Yeah.
Those must be discussed, and of course, in an environment where it is controlled, not just them alone,
Yeah.
but in the environment of the family.
The family needs
Because
to
that is affecting it's a family issue.
It is. It
Now,
is.
when it comes to that, and when it comes to eating, the person who is likely to be disrupting that family session, guess who?
Who?
Guess.
The person who's sick.
You see, you bring a family, you have an anorexic child,
Yeah.
you bring the family together, mother, father, and maybe children, brothers and sisters, to talk about their daughter or
Yeah.
their sister,
Yeah.
and you have them in a family situation like you would have
Yes.
here in my office.
Yes.
Who is likely to disrupt that meeting? The father, the mother, the siblings?
Maybe the father.
No, the mother.
Why the mother?
Because this girl of mine is not eating as she must eat. Yeah. So the person.
Mothers, are you hearing?
So the person to control
Is the mother.
Is the mother. Understandable. So you don't say no. Say we
Yeah.
understand, but please help us to help
Your daughter.
Help your daughter.
I'm just wondering, Professor.
Yeah.
Just trying to think like a layman,
Yes.
an African layman, and I'm
Yeah.
thinking, would I be right to think hizi ni shida za watu wako na pesa? From this perspective, that if we are coming from a background even where putting food on the table is really a struggle, would I really struggle with eating because I'm going to be fat? I think it would be the opposite. I will eat whenever I can get the food.
Yes.
But when I know it is available and there's a surplus, then I start worrying about such things.
Yes.
Would I be right to think along those lines?
No, you not be completely right, and I'll give you the reason.
Yeah.
We don't have our own statistics, although we see cases. I can't say we have done good epidemiological. We have done, apart from a bit of bulimia and aphasia, which we'll have time to talk about.
Yeah.
The statistics that have been done in the West is like 4% of girls have this kind of problem. And the reason why I am saying an environment is important, where an environment means availability of food. It's not just the availability of food alone. There could be what we call a genetic predisposition.
Oh, okay.
And you have no control over that.
Okay.
Whether you have access to food or no access to food is a genetic predisposition. It tends to run through families. So that if a girl has this condition, anorexia nervosa, there is a higher risk, higher chance of finding other people in the family with a similar problem.
Yeah.
So we are talking about a genetic predisposition.
Okay.
It tends to run through families. But even so, even when you have a genetic predisposition, it is also very true that the environment also plays a part. It is got what we call a modulating effect. In other words, because of the social pressure, particularly from the mother, here you have to eat.
Yeah.
Young people, they have different ways of doing things. Maybe they think they look better if they are thin or whatever the trend is.
Yeah.
That will be a kind of a social pressure to behave like what you think is the normal way to behave in that particular situation. It may also be something to do with the fact that even though there is a genetic predisposition, even when it does not present with those symptoms, somebody who has been brought up in an environment where they have one meal a day, then they will know eating is necessary for survival.
Yes.
So it is a combination of very many things. And as I said, when you have a girl with this kind of problem, don't rush into saying maybe the environment, maybe where you come from, maybe plenty of food at home. Every individual
is unique.
Very, very unique.
Yes.
You know, I keep on saying, and I think many psychiatrists will say, I don't know how many patients I have seen since I started training as a psychiatrist many years ago. I have never seen patients who are totally identical. Yeah.
That is true.
And therefore, you can't say, you can't put people in a group and say, you people have this kind of thing, you take this, go and take this, go and take this, go and take this. No, every individual will be treated as a unique entity.
Okay.
Yeah.
Food for Thought with Professor David Bitte.